I'm Don Martin, and welcome to my photo story on diversity in healthcare. I hope you enjoy it, and I hope you learn something from it. Let's start by asking the question, what is diversity? For most of us, the first thing that comes to mind when we think of diversity is the difference in races. But is that really diversity? Is that really all there is to diversity? Is there more? After all, if two women of different races were raised in the same family, how different would their cultural views be? Probably not so different. So diversity is more than just race. Diversity includes cultural differences, social economic background, age, gender, and a host of other things that make us so wonderfully different and contribute to the creative and collaborative processes that we call life. Take a look at this picture, for instance. How much diversity is there actually in this picture? The people pictured are all women. They're all under 30. They're probably all from middle-class families. While they each have characteristics that are unique to them, they're also very similar. The state of Texas, where I live, is now known as a minority-majority state. I believe we're unique in that designation, but what does it mean? It means that the population in Texas is less than 50% white and that the minority populations of Texas now outnumber the white population. So why does this matter when we're talking about healthcare workforce and diversity? Of the 19,000 students that attended El Centro College in the academic year 2012-2013, more than 12,000 of them were either Hispanic or African American. That's 63% of the total population. This is a picture of one of El Centro's healthcare programs. Does the picture reflect the diversity of El Centro College? This is the current class of sonography students. 37% of El Centro students are men. There's not a single man in this picture. And it's not just a sonography program. The various programs at El Centro College reflect a trend in healthcare in general. According to the Sullivan Commission on Diversity in Healthcare Workforce, African Americans, Hispanics, and Native Americans combine to make up only 9% of our nurses, 6% of our physicians, 5% of dentists, and 10% or less of the faculty in the education of each of those areas. All of the students in this picture are from the Dallas area. They represent a population that, according to the most recent U.S. Census, is 34.56% white alone, 25.91% black, and 35.55% Hispanic. That's 96% of the total population, with whites making up just over one-third of the population. So why is healthcare so monoculture? Why doesn't this picture reflect our culture? According to the U.S. Department of Health and Human Services, in 2013, there were over 14 million allied health professionals, and that doesn't include doctors and nurses, in 35 different occupations. This group of allied health workers make up 10% of the U.S. workforce. The U.S. Census Bureau reports that in 2011, approximately 9.6% of all nurses were men. Men certainly make up more than 9.6% of the total population. Why aren't men choosing nursing? These are among some of the highest paying jobs in the workforce. In fact, nursing doesn't look so different in makeup from the rest of the allied health workforce. Healthcare, with the exception of medicine, is dominated by white women. So now let's change our reality. Poverty-level populations are disproportionately low in representation in allied health, nursing, and medicine careers. At the same time, poverty is relatively high among Hispanics and African Americans. Is the issue one of culture or poverty, or are they the same thing? Remember earlier when we were talking about diversity and what it is, we included socioeconomic status. Since we're changing our reality here, let's consider how we change the reality of our culture. There are 3 recommendations that reoccur frequently in the literature related to cultural diversity in the healthcare workforce. First, to increase the diversity in the health professions, the culture of health profession schools must change. We have to begin to examine the practices of our institutions to determine how to better meet the needs of the various communities of interest. Second, we need to begin to explore new and non-traditional paths to the health professions. This will probably require reshaping the way we approach K-12 education as well. Third, there must be a commitment to change at the highest levels. Change only occurs when institutional leaders support change. The Duke University School of Medicine did not admit the first black student until 1966. Today, Duke has one of the most diverse medical school populations in the country. Change only occurs when leadership buys into change. The leadership we're talking about must be provided by the key stakeholders in developing complementary strategies to increase diversity and ensure cultural competence at all levels of the healthcare system. There needs to be a paradigm shift in society's view of the underrepresented minorities as a resource for creativity, collaboration, design, implementation, and evaluation of new programs, curriculums, and initiatives. For true change to occur and to increase diversity in the healthcare workforce, public and private funding entities will have to increase funding for research. The focus of that research will be eliminating the disparities in the healthcare workforce and minority health status and eliminating racial bias and stereotyping. Healthcare systems will need to set measurable goals for increasing the representation of multilingual staff and cultural diversity, and improving communication and language skills of all healthcare providers. Health profession schools will need to work on increasing the number of multilingual students and language training for practicing professionals. Finally, and perhaps most important, the key stakeholders in the health system will have to promote training in diversity and cultural competence for health professional students, faculty, and healthcare providers. Only by adopting a broad strategy of change can we hope to banish the ghosts of segregation that continue to haunt the health professions. A comprehensive strategy for success will take a great deal more planning, but it will require participation at every level. The fate of our healthcare system and our society's health is depending on the outcome of our future efforts to include all aspects of diversity in the healthcare workforce. Thank you for taking the time to participate in this presentation. I hope that this presentation can be a starting point for the discussion that will lead to meaningful changes in the way we do business in healthcare and healthcare education. Greater diversity in healthcare can only mean better lives through better health and greater opportunities for everyone in our communities.